Here on Jersey Magazine this morning, the question is, what color is your pee? And that sounds kind of silly, but it's a rather important question. My guest, welcome back Dr. Michael Garko. He's a medical researcher and credentialed nutritionist with a master's degree in human nutrition from the University of Bridgeport. Dr. Garko, good morning and welcome back to WDHA and Jersey Magazine.
Well, thank you, Jim, for inviting me back to see you and talk to you again today and talk with your audience. I know this is a peculiar topic, talking about pee or urine, but it's something that has practical value and can be helpful to people to know something about.
It's almost as if it's kind of your body's way of telling you, well, not almost as if it is your body's way of telling you if you're on the right track with certain things or not.
Yeah, you're right about that. I mean, urine has been a useful tool of diagnosis since the earliest days of medicine. Doctors have always relied upon urinalysis and looking at urine. The urine can tell you a lot about what's going on in your body, as you suggest, from how hydrated you are to whether or not you might have a urinary tract infection. So the color of the urine, even the smell of the urine, can indicate some issues, right? And so color is kind of interesting. People probably don't think of that too much. But if you think about what urine is, it's a mixture of water, electrolytes, and waste material that your kidney will filter out of the blood. That's what the kidneys do. When you're healthy and hydrated, notice hydrated is important. The urine should fall somewhere between colorless and the color of light yellow straw. When you don't consume enough fluids, especially water, your urine becomes too concentrated and turns a darker yellow or amber color. And so it's not unusual for the color of urine to vary a little from day to day, but it should stay in a certain range of yellow, that light yellow colored straw. So it's important to know certain foods, antibiotics, laxatives, dyes, illness can cause the urine to change color.
You know, I do a lot of youth baseball clinics, especially in the summertime, and invariably you get a string of really, really hot days. And we'll talk to the kids afterwards. And, you tell them, make sure you drink when you go home tonight, water, not soda. And tomorrow morning when you wake up, check the color of your pee. And they laugh. And I tell them, the darker it is, you need more hydration. And one kid said to me this past summer, hey, you're right. I noticed that the other day. It did look different.
Yeah. So, pale to straw, you can tell your youngster that pale to straw to a dark yellow color, that's the preferred color of urine. Urine falls between that pale yellow in that pale yellow category and signals that you're pretty healthy. You can get an amber or honey colored urine. The darker the U is a sign of mild dehydration. So if it starts to get sort of look like honey, that little darker color, it means that, like with the kids, they're sweating all day, they become dehydrated, they can suffer from hyponatremia, not enough water, right? And that's not good. Then you can get urine, Jim, where it's a syrup or brown ale color. It's now getting darker. That means that a person is severely dehydrated. That dark brown colored urine is caused by the bile getting into your urine. It's a sign of liver disease. See, that would signal to somebody they may not know they have liver disease, but if their urine starts to look like that like ale, that real dark ale color, that brown ale color, and then you can get rusty or a brown colored pee, which is a symptom of what they call porphyria, which is a rare disorder affecting the skin and the nervous system. So you start to see how urine gets implicated with your health, and doctors use it as it sounds kind of primitive compared to all the high technology, but it's really a basic fundamental empirical way to dial into a patient or a client and figure out what's going on. And believe it or not, urine can be pink to reddish color. For example, food now, if you eat beets or blueberries or rhubarb, your urine is going to take on that color. I remember one time, as much as I thought I knew about this, I was eating some beets, and a couple hours later, I went to the bathroom and it was red. I thought, oh my, I almost panicked. I thought it looked like blood. Blood in the urine is not good.
No.
No, not good. And then I remembered, oh, hell, I ate some beets. That's why I even had forgotten. So food can change the color. Urine can be even orange. You may not be drinking enough water, and if your pee looks orange, that could be, again, another sign of liver or bowel duction problem. So hydration is critical. Drinking water. Tell your youngsters that coach that they need to stay hydrated. And when you're thirsty, it's too late. You now thirsty. Being thirsty is not a good sign that you should be drinking water. You should have been drinking water before you got thirsty. You got thirsty because you waited too long.
What are the dangers of drinking too much water, though? I've heard about that lately.
Yes, good. Man, you're so smart. Hypernatremia. That's hyper. Remember, I mentioned hyponatremia. Hypernatremia is when you have too much water, which causes your blood to become watered down. A good example, when people are running these long races on hot days, they lose both salt and water in their sweat and often replace these with mostly water. This combination could be deadly because it's diluting the remaining of the sodium in your body. Sodium, and I know salt has a bad reputation. We got to watch too much sodium, but sodium is one of those part of those electrolytes. It's very, very important. And if you get too much water, you will lose too much. You'll lose too much sodium. So it's hypernatremia. And I go to the gym 6 days a week, and I see these people walking around with a gallon jug of water, and I'm thinking, what the hell are you doing? You should have been hydrating before you walked into the gym, and you can drink too much water. People drinking 2 gallons of water a day, that's nonsense. 8-ounce glasses a day, a liter, whatever, but drinking a couple of gallons of water a day, that's not necessary. And I think that's more harmful than not.
Where do sports drinks factor into the hydration equation, Dr.
Sports drink
Garko?
depends on the quality of the sports drink. Another good question. Some of the sports drinks have too many coloring agents in them, too many chemicals that have nothing to do with trying to keep you healthy. The sports drinks are intended to help replace electrolytes. These electrolytes that are really important in maintaining homeostasis in your body, making sure you got enough water inside the cells and outside the cells. And so sports drinks can be very useful. At the end of the day, however, there is no real substitute for what the chemists say, like pure water. It's just water. And I drink bottled. This is the truth. I have not had a glass of water from the faucet in decades.
Wow.
I do not drink from the faucet. I don't like what they do at the water chemical plant at the plants where they're putting all the chemicals in the water. I swear to you, I have not had a glass of water from a fountain, maybe 40 years. My girlfriend comes to the house. I have a nice refrigerator, has a filter in it. I won't even drink water from that. And she looks at me like, she shakes her head like, what's the matter with you? So I buy a bottled water, and I use the reverse osmosis process when they use that process. I even cook with bottled water. When I make pasta, I don't use the water from the sink, from the faucet. I'll use the water that I have out of a gallon jug that's been filtered. Maybe I'm a little crazy about that, but that's my point of view about it. I'm very particular.
Dr. Garko, for WDHA and WMTR listeners who want to learn more about you, where do they go?
Go to Strauss Naturals, Strauss. There's a link there that says Ask Dr. Garko. And by the way, they have 2 products, a kidney support drops and bladder support drops. I do both of those. A along with the heart drops, given that, given my age and my health status, I want to take care of my heart and my kidneys, and they're connected. You can learn more about those products there, but I get about a dozen hits a day, and I answer every single one. StraussNaturals.com. Click on the link, Ask Dr. Garko. And Jim, thank you for having me back. It's always a pleasure to see you, man.
You're very welcome. I enjoy chatting with you, Dr. Garko. Thank you for your time.
I'll see you next time.